My name is Joe Fakhoury. I'm a staff dermatologist at Henry Ford Hospital in Detroit, where I direct the alopecia clinic and work in our clinical trials unit. We're here at the NAV conference, which has been an incredible opportunity for patients, researchers, clinicians, and industry to come together to help us keep advancing progress in the space of alopecia areata management. So today in the current treatment sessions, we started with a talk about the currently FDA-approved treatments for alopecia areata, including baricitinib in patients ages 18 and up, ritlecitinib in patients age 12 and up, and duruxolitinib in patients age 18 and up. We went through when to expect treatment response, and that in some patients are early responders, some are gradual responders, and some are late responders. We talked about how starting treatment earlier, usually less than when the patient's current episode has been less than 4 years, can lead to better treatment response, although patients can respond at any point after starting treatment. And we also discussed how starting treatment before severity reaches a higher SALT score can also help with better outcomes. We reviewed the monitoring and the side effects, the most common ones, and we also talked about how the black box warning that exists for the JAK inhibitor class of medications was done in patients with rheumatoid arthritis, taking a different JAK inhibitor called tofacitinib that showed a higher risk of things like blood clots and cardiovascular events and malignancies and infections. But thankfully, our data in the alopecia areata population in JAK inhibitors has not shown significant increases in these outcomes. We then talked about the treatment pipeline for alopecia areata and treatments that are not currently FDA approved but are in trials to hopefully at some point gain FDA approval depending on the outcomes of those trials. We started with discussing baricitinib in patients aged 12 to 17, and then we talked about upadacitinib in patients ages 18 and up that has already been submitted to the FDA, and right now trials are ongoing in patients ages 12 to 17. We then went into a discussion of medications that are not JAK inhibitors, including things like Respeg, which has had phase 2 data, bempikibart, which has phase 2 data as well, Imagine 007, which has early data, and a topical solution called Simenu, which has been trialed in kids ages 2 to 18. So we're excited about the future and for what additional data we're going to gain on these medications, and hopefully to obtain more information about what we can expect for treatment outcomes for our patients so that we can continue to offer the best and most precise and most effective care for all of our alopecia areata patients.